Hi everyone, my name is Marianne Ripley and I will be sharing you today my informative speech. For my topic, I choose to inform you about the amyotrophic lateral sclerosis, or in short, ALS. Do you recognize the man in the wheelchair? He is Dr. Stephen Hawking, a renowned physicist who lived with amyotrophic lateral sclerosis for 55 years. You may have heard of the Ice Bucket Challenge on social media, but I didn't fully grasp its significance until I worked as a care provider for a veteran with ALS. This progressive neurodegenerative disease gradually robs individuals of their ability to move, to speak, and breathe, even as their cognitive function remains intact, creating a challenging situation for those affected by the disease. My topic will provide an overview of ALS, including its causes, risk factors, symptoms, as well as how it is diagnosed and treated. This information is crucial for understanding a condition that impacts many lives, and it also raises awareness about the ongoing need for research funding. That is because this disease is not really widely known. Out of 20,000 people, only one gets diagnosed with it. According to Mayo Clinic, ALS, or amyotrophic lateral sclerosis, is a neurodegenerative condition that affects the neurons in the brain and the spinal cord. It targets the motor neurons, and these motor neurons regulate our muscle movements, like the ones we use to talk, chew our food, and move our arms and legs, and also breathing. Your neurons communicate with your muscle to tell them to move. In addition, it is also called Lou Gehrig's disease. It is named after the baseball player who was diagnosed with the disease. According to Cleveland Clinic, there are two types of ALS. We have sporadic ALS and familial ALS. Sporadic ALS, an estimated of 90% of all ALS cases are sporadic. This means that the condition happens randomly. It isn't inherited or passed down from biological parents to children. While familial ALS accounted to 10% of ALS cases, and this is known as or classified as familial. It is a gene exchange mutation that causes it. You inherit the gene exchange from one or both of your biological parents during conception. That's for the familial ALS. Now, according to Cleveland Clinic, researchers don't know what causes ALS. They believe it's a combination of the following factors. First is the genetics, which changes or variants in certain genes may cause ALS in up to 70% of familial cases and 5 to 10% of the sporadic cases. There are more than 40 genes related to ALS. Some types of ALS are genetics. You can inherit genetic changes that causes ALS from your biological parents, and also inherited ALS isn't common, though sometimes genetic changes happens randomly without a history into your biological family. The next one is environment. Environmental factors play a key role to this, and that is this exposure to certain toxic substances like lead or mercury, viruses like mold, fungus. Those, and the other cause is a physical trauma may also cause ALS. According to Mayo Clinic, the following are the risk factors. We mentioned about genetics earlier as one of the causes. It's also one of the risk factors. For about 10% of the people with ALS, a risk gene was passed down from a family member, and this is called hereditary ALS. In most people with hereditary ALS, their children may have 50% chance of inheriting the gene. The next risk factors is age. Risk increases with age up to age 75. ALS is most common between ages 60s and the mid-80s. Sex. Before the age of 65, slightly more men than women develop ALS. The sex difference disappears after the age of 70. Another one is smoking. Evidence support that smoking is an environmental risk factor for ALS. Women who smoke seems to be at even higher risk, particularly after menopausal stage. We mentioned earlier about the environmental toxin exposure. That's another risk. Some evidence suggests that exposure to lead or other substances in the workplace or at home might be linked to ALS. Much study has been done, but no one agent or chemical has been consistently associated with ALS yet. The next one is military service. Studies indicate that people who have served in the military are at higher risk of ALS. It's not clear what about military service might trigger ALS. It might include exposure to certain metals or chemicals, traumatic injuries, viral infection, or intense exertion. And next, let's proceed to the symptoms. ALS symptoms include muscle weakness, muscle cramps, twitching, stiffness of the muscle, speech challenges, drooling, involuntary emotional expression like laughing or crying, fatigue, trouble swallowing, or dysphagia. These symptoms start out mild and get more severe. The speed at which symptoms progresses varies from one person to person. It may be more difficult for you to do routine things like writing your name or buttoning your shirt. Those are the early signs. You might need more time to eat meals than usual. No matter where the symptoms begin, they spread to other parts of your body gradually. ALS is challenging to diagnose as there is no single test to confirm it. Diagnosis usually involves a clinical examination and various tests to rule out similar disease, including a comprehensive workup of multiple procedures. Diagnosis involve clinical evaluation, patient history, and ruling out other disease. Tests that being performed include blood tests, urine tests, electromyography, and nerve conduction studies. Another one is a lumbar puncture or muscle or nerve biopsy. Last test is MRI, imaging to look at your brain and your spine. The treatment available for this disease includes medication, riluzole, edaravone, and another supporting treatment are physical therapy, speech therapy, and nutritional support. Though there is no cure for ALS, ongoing studies on gene therapy and innovative treatments are trying to find a cure for it. Right now, it's considered as terminal illness because there is no cure for this disease. For medication, riluzole and edaravone have been shown to slow the progression of the disease. And as I said earlier, supportive therapies like physical therapy try to keep them moving for as long as they could possibly do, and speech therapy trying to retain their ability to speak, and nutritional support as they're gonna come to a point where they need a peg tube feeding because they won't be able to swallow anymore. And as mentioned, ongoing research to explore gene therapy is still one of the priorities that they have with the ALS Association. So let's recap the information I shared with you today. Understanding ALS by defining the term and identifying its causes, risk factors, symptoms, diagnosis, and treatment. Now that you are aware of it, I'm encouraging you to support ALS research and awareness initiative. Though ALS present numerous challenges, the dedication of researchers and the strength of the community's supports offer a glimmer of hope for those living with the disease and their loved ones. Together, we can make a difference in the fight against ALS. Thank you.